I'm a lifelong Republican and I'm pro-business.
I'm a Georgian and I believe in personal responsibility.
I'm a Georgian and I rely on my Social Security and Medicare.
I am a mother and I believe in immigration policies that support family unity.
My party is not fiscally responsible anymore.
It's irresponsibility that's costing us our lives.
It threatens my Social Security and Medicare.
It is keeping our families apart.
That's why I am voting Ossoff and Warnock.
TSP Victory is responsible for the contents of this ad.
ఎక్స్చేంజ్ 8,000 రూపాయల బ్యాలెన్స్ మ్యామ్.
ఇవ్వనక్కర్లేదమ్మా, 8,000 మీకే వస్తాయి.
ఎస్ మ్యామ్, మేము కేవలం హాల్మార్క్ 916 గోల్డ్ నే అమ్ముతాం. ఇంకా మీకు దొరికింది 100% ఎక్స్చేంజ్ వాల్యూ.
క్వాలిటీ, ఇది మలబార్ ప్రామిస్.
ఇది మా హీరో అల్లుడు కోసం ఫిట్ గా ఉంటుంది.
పర్ఫెక్ట్ గా ఫిట్ అవుతుంది. ఇది మైండ్ డైమండ్, 100% క్వాలిటీ.
సార్, ప్రతి మైండ్ డైమండ్ న్యాచురల్. ఇంకా మేము 28 క్వాలిటీ టెస్ట్లు చేస్తాం.
28 టెస్ట్లా?
ప్రతి డైమండ్ జ్యువెలరీతో పాటు ఇంటర్నేషనల్ ల్యాబ్ సర్టిఫికేట్ కూడా.
కళ్ళు మూసుకుని మీ హీరో కోసం వజ్రాలను తీసుకోండి. ఇది మలబార్ ప్రామిస్.
Hello viewers, welcome again to TVASIA Telugu channel Healthline, and this is a special series, SATI, South Asian Total Health Initiative series, which is brought in collaboration with SATI. SATI is South Asian Total Health Initiative, which is a group of physicians based in Rutgers Medical School, New Brunswick, New Jersey, and their goal is to advocate for community health education, advocate for preventative health services, and share all their knowledge with the community members as well as with their patients so that they can take care of their health through their disease management as well as through health prevention. Today, we have a special guest with us, Dr. Biren Saraiya. Dr. Biren Saraiya is a specialist in hematology and oncology, as well as palliative care. He has been with SATI for many, many years. And I would say, since inception of SATI, Dr. Saraiya has contributed his expertise, his valuable time, and he has advised many, many patients about cancer treatments, preventative services, and how to stay healthy. It's really a great pleasure to have Dr. Saraiya with us today, sharing his expertise with all of us and giving us all those tips so that we can implement it in our life. We all know that cancer is a grave disease. When to diagnose, how to prevent cancer, how to take care of this grave disease, all these things are always a question in our mind. So, without much delay, I am going to introduce Dr. Biren Saraiya. This is your host, Varsha Singh, bringing you Healthline SATI series on TVASIA Telugu channel. So please join me in welcoming Dr. Biren Saraiya. Welcome, Dr. Saraiya.
Thank you, Varsha. Great to be here.
Dr. Saraiya, it's such a great pleasure to have you on this special series, SATI series, where we are going to discuss some key points about oncology, hematology, as well as some preventative practice that you have always advocated for your patients. So as we initiate this conversation, my first question to you, as our viewers would like to know about you, who is Dr. Saraiya and what does he do? So if you can introduce yourself and give a little bit about your life, what you do, and about your expertise.
So my name is DR.Biren Saraiya. I'm a faculty member at Rutgers Medical School. I am an oncologist, and that's where my practice is. I'm also a researcher. I focus on supportive care, supportive oncology, and communication skills. So that's what I do in my academic setting. Outside of work, I live in Central Jersey. I was born and raised in Gujarat, but I've been here for more than 30 years, and I've made Central Jersey my home, and that's who I am.
Thank you so much, Dr. Saraiya. I also want our viewers to know how you got involved in Sati and what was that time and what brought you to that forum of physicians or healthcare providers that primarily thought about on philanthropy, that let's go and educate our community members. So if you can share your history with Sati.
I was a medical student and a resident at Rutgers Medical School in New Brunswick. And I had always thought about, when you look at literature, we talk about diseases, we talk about what's normal, what's abnormal, and always felt that South Asian was different. And we needed to study ourselves. And we have different health needs and really need to have an organization that focuses on that. So working with some of the public health associations, which I was interested in, and then, collaborated with Dr. Gore and others who started Sati. And really, my focus really became more on cancer and cancer prevention, cancer treatment. But the idea that we are not just a typical American population, I think this is an important one. There is something different about South Asians, both in our risk factors, in how we present our diseases, and how we take care of ourselves. So we really needs to be appropriate, focus on South Asian. And that's been my focus from the beginning.
I think I would agree with you, Dr. Saraiya, that even though we have settled down here as Americans, but our genetic background, our heredity, and our cultural practices, we are still South Asians with different needs, a different way of looking at all those health conditions. We have our own set of health beliefs, and it really makes a big difference if a patient who is suffering from a certain chronic disease or a grave disease, they would find a lot more culturally competent care if there is someone who is providing that care with that South Asian focus.
I agree with you. And, this is what I teach in medical school. The doctor, myself, I may be taking care of a South Asian patient or a different patient, but we need to be culturally appropriate. And that was the right word that you used. And I love that. I think we need to make sure that we listen to our patients and understand their perspective to make sure that they follow through on what we want them to do and build that partnership with our patients.
Yeah, and just to elaborate further on that point, the whole purpose of creation of Sati, if you think about the whole name, South Asian Total Health Initiative, the underpinning of that group is to provide a culturally competent care and address the needs of the South Asian group. We have discussed it in earlier episodes as well, that it's not just people from India. We include in South Asians, Pakistani, from Bangladesh, from Sri Lanka, from Nepal, from Bhutan. So it's a group of people who identify themselves as South Asian, and the whole program that Sati puts forward is always targeted towards this South Asian group. So Dr. Saraiya, I really want to ask you questions about your expertise, and really bring some points forward so that our community learns from you. And this episode becomes kind of a wake-up call, or it opens eyes towards how we look at cases, especially the hematological disorders, oncological disorders, and as well as palliative care. So we would go step by step. And my first question would be, for South Asian community, what are those typical disorders that you see and where our focus should be? And if you could talk about, number one, that we should be aware of our risk, and number two, that this is what you need to do about screening, which is early diagnosis. And then we will discuss about what are the treatment options and what does it entail. So forum is yours, and viewers are listening.
So when I think about cancer, and I think you're right, I think all of us have a fear of just the C word. And so I think about how do I avoid that? So the prevention is probably one of the first things, and I would sort of focus on that. How do we prevent it? And that comes back to our habits. That comes back to what we do with our bodies. There are some things that are in our control, some things that are not in our control. So that's sort of the first thing. The second thing is, how do we make sure that we find a problem looking for diseases when they're starting off as early as possible? So focus on screening next. And that is the treatment. Once you have the illness, how do we best care for it? One of the best things I can tell patients, or not patients in this case, our community is, don't ever have the need to see me. I would love to be unemployed, which means there is no cancer to need to be treated. So if you can prevent and screen and treat early, hopefully you won't have to see me. And that's the best thing I can ask for from our community.
That's actually, Dr. Saraiya, is very altruistic comment. And I would say not many physicians or not many doctors would say that I prefer that my patients don't see me. But that's actually the crux of the matter, that we really want our patients to be healthy and happy and enjoying the quality of their life. But your role is equally important in teaching this community how to screen and how to prevent. So they still need to see you, in my opinion. Yes.
Well, I can do other things, and this is like right here what I'm doing right now, educating and preventing having them actually have the problem. And I would love to just do that. So I will keep myself busy doing that.
Okay, Dr. Saraiya. So let's go to now really specifics. And I want to have our viewers have a kind of a general idea that what are the cancers that we should be really aware of. Because if you look at the Caucasian population, they're really focused on the skin, where exposure to sun, and they are at high risk. So similarly, in our South Asian population, we can talk about for men, if you can provide some idea about what are the screenings that the men should be focused on and compared to what women should be focusing on. And where does it start? At what age they should be thinking about all these preventative screenings, and where can they go? Because the community members, number one, the awareness about what to do, how to do, when to do, and then where do I go? These are all the questions that they always have. And I have seen in my experience that you constantly need to educate them.
So let me first provide a framework. So I think when I talk about, you started with great. So let's talk about men and then women, or vice versa. And then talk about screening, looking for early diagnosis of cancer, and then prevention. So actually we'll do prevention first and then screening. And then the question is, where do we get this care? So let me address the last question first, because that applies to everybody. So I think one of the first things is to focus on how do we make sure you stay healthy? And this goes beyond cancer care. So having routine physical evaluation with a primary care doctor is a first great step. The primary care doctor can educate you, and they're well versed in this, behaviors to prevent cancer, habits that lead to risk of being a cancer, and then screening at appropriate age. I will talk about some of the screening guidelines, but just remember, this guidelines change. So if you look at this in 2022, there may be a different guideline present at that point in time versus what is in 2020. So that's the approach I'm going to take for the next few minutes. So let's talk about prevention. So what do I mean by prevention? So there are some diseases that we have that we may be at risk for, based on what we use, our habits, what we drink, and also what our environment is. And many of the stuff comes from both the South Asian as well as Caucasian population. So this is ubiquitous across the world. So we know, for example, smoking is probably one of the biggest risk factors for many cancers. Cancers of the mouth, tongue, throat, lung, bladder. All these cancers are higher risk in patients or people who have smoked. For South Asian, and again, especially and many of the people I know, is the chewing tobacco. Tobacco is just not about smoking, but chewing as well. So the many I see in our clinic, one of my colleagues, Dr. Patel, she's the head and neck cancer specialist at Rutgers Cancer Institute. And I can tell you that we have a Gujarati and South Asian males who have chewed tobacco all their lives. And so that's probably one of the most commonly preventable illness. It is completely preventable if we were to reduce the risk of having it in the first place. So tobacco is probably one of the biggest things when it comes to prevention. That's absolutely right. Both chewing and smoking. I think both of them put you at risk. Now we all know that we know this. Everyone knows this, but it is a habit. So again, we think about prevention, making sure the new generation doesn't pick up that first cigarette or the first pan parag or whatever that is. I think that's the first thing.
You said it.
I'm sorry?
I said you said it.
Yeah.
We need to role model to our children.
Yeah. And then the second thing is, listen, if you picked it up at age 13, 14, your 20s, 30s, 40s, it's a bad habit. So you really need a supportive environment and will to try to quit. Now, I talk about smoking cessation and tobacco cessation with my patients all the time. And what's really important is don't ever give up. You tried once, you gave it up for a week, 2 weeks, whatever it was. Okay, habit came back in, go back at it. Try it again and again. Don't ever lose hope, because I think that's really important. Every time you try, you increase the chance of success the next time. So keep at it. You really need a supportive environment. You need family members who can help you, friends who can help you. So ask for it. I will also share with you the tobacco cessation program at Rutgers. And there's a program that people can call in and get help. And in COVID-19 situation, we're doing a lot of remote visits. So you can do this from the convenience of your home. So I encourage those who are even thinking of saying, okay, I know this is wrong, but I just need some help, to call that. And I will share that number with you later on.
Thank you, Dr. Saraiya.
So that's the prevention and smoking related. I think the second part, and this is becoming a bit more known, is we are understanding that our diet and exercise, things that we all kind of think about for heart disease, may actually have a role in cancer as well. So we are learning this, that obesity is a risk factor in many cancers. So I think, again, thinking about COVID-19, I've been having this conversation with my patients every day for the past 6 months. This has presented us as a challenge, which is, how do we spend our time? Because you can't do the same things. So let's pick up a new hobby, and let that hobby be, what do you do for yourself? Whether it's yoga, whether it's meditation, whether it's exercising, cardiovascular exercise, where you run or where you do some lifting, whatever it is, whatever your passion is, what do we think about? And again, same with smoking cessation. Try it every day and see what happens. And if you try it every day for 3 months, 4 months, it may become a new habit, and you may become a healthier person, and not just from cancer perspective, from total health perspective, which is our objective.
Dr. Saraiya, I think I really like the way you are suggesting that cancer prevention is not just giving up a particular habit, but a holistic approach is treating our whole body in such a way that it's I think the whole theory that you're proposing is that prevention is in terms of treating your whole body as a temple and just nurturing it in such a way that you do not allow all those negative elements to enter in your mind or body. And that way, once you go towards that spectrum of really having that caring attitude towards your body, then naturally those vices, which you call as habits, smoking, tobacco chewing, or physical inactivity, which are precursors of cancer, can be prevented. I think this is a very strong message, and I'm sure our viewers will implement it. It's coming from a physician who says this can prevent your cancer.
Yes. And the last thing is the alcohol. Leads to many diseases, including gastrointestinal cancers, liver cancer, and other diseases. So I do think, again, these are habits. These are things that we're surrounded by that we choose to do. And I think that's really important. So I would encourage everyone to just take that first step. And then if you've taken the first step before, take the second step. Or keep at it. Don't lose hope. Don't give up. Just keep at it, and you will be successful. So that's probably the most important thing. Now there's the other topic, which is our environment, and so some things that we can't completely control, but know it, right? So there's a large population in New Jersey in 80s and 90s. They did not know they were exposed to asbestos, but now we do. So be aware of your environment, and as much as possible prevent that. Prevent exposures to things that can cause cancer. And the two biggest ones are the smoking, secondhand smoking, and doing it ourselves. So I would encourage everyone not just to do it for yourself, but do it for your family. When you smoke, you increase risk of asthma in your child. When you smoke, you increase a risk of cancer in your family members who are exposed to it. So I think that's the most important thing. Do it for yourself and do it for your family.
ఎక్స్చేంజ్ 8,000 రూపాయల బ్యాలెన్స్ మ్యామ్.
ఇవ్వనక్కర్లేదమ్మా. 8,000 మీకే వస్తాయి.
ఎస్ మ్యామ్, మేము కేవలం హాల్మార్క్ 916 గోల్డ్నే అమ్ముతాం. ఇంకా మీకు దొరికింది 100% ఎక్స్చేంజ్ వాల్యూ.
క్వాలిటీ. ఇది మలబార్ ప్రామిస్.
Mom, what did the man mean when he said go back to where you came from?
Go back, wherever you're from.
Why do they make fun of my name at school? Dad, who will protect us from climate change?
Global warming, and a lot of it's a hoax. It's a hoax.
When is Mommy coming back from hospital?
Our family's future is at stake. The choice is ours. Vote Asaf and Warnock. TSB Victory is responsible for the contents of this ad.
ఇది మా హీరో అల్లుడు కోసం ఫిట్ గా ఉంటుంది.
పర్ఫెక్ట్ గా ఫిట్ అవుతుంది. ఇది మైండ్ డైమండ్, 100% క్వాలిటీ.
సార్, ప్రతి మైండ్ డైమండ్ న్యాచురల్. ఇంకా మేము 28 క్వాలిటీ టెస్ట్లు చేస్తాం.
28 టెస్ట్లా?
ప్రతి డైమండ్ జ్యువెలరీతో పాటు ఇంటర్నేషనల్ ల్యాబ్ సర్టిఫికేట్ కూడా.
కళ్ళు మూసుకుని మీ హీరో కోసం వజ్రాలను తీసుకోండి. ఇది మలబార్ ప్రామిస్.
హాయ్ గైస్, నేను మీ హేమచంద్ర. సో ఈ ఆదివారం ఒక క్రేజీ సాంగ్ తోటి మీ ముందుకు రాబోతున్నాను. ఒక బొక్కపడ్డ లవ్ స్టోరీ ఒక క్యూట్ సాంగ్ లా తయారు చేసి మీ ముందుకు తీసుకురాబోతున్నాను. సో ఈ సండే నా యూట్యూబ్ ఛానల్ హేమచంద్ర అఫీషియల్ లోను రిలీజ్ అవబోతుంది. అండ్ అలాగే టీవీ ఏషియా తెలుగులో మీరు ఈ సాంగ్ ని వినబోతున్నారు. సో ఇండియన్ స్టాండర్డ్ టైంలో 10 AM కి ఈ సండే మేక్ ఇట్ ఎ ఫన్ డే విత్ దిస్ లవ్లీ బొక్కెట్టనే సాంగ్.
Every family who really loves their children and they want to do everything good for the family, this is one aspect of their life as well, that you have to be aware of the environment. If you are doing everything right, if you are cooking good food so that your family eats it and feels happy, then why not the environment? Create that healthy, clean environment so that they can continue to live healthily for a longer period. That's really a nice tip that you provided.
Next step is screening, right? So here we have prevented things that are under our control. Now, we know cancer is a disease of age. What I tell my patients when I first meet them, and this is the honest truth, as I sit next to you, I'm at risk of having cancer in my body. I just don't know it. And that's true. So how do we make sure that we find cancer at the earliest stage? And for some cancers, we know. And this is where we're going to sort of divide into men and women. So we know that in general, women are at higher risk of developing breast cancer. And it has nothing to do, or may not have anything to do with what they did. It just is a statistic. And men have prostate gland. They're at high risk of developing prostate cancer as we age. Each man is at risk for it. What's really important when it comes to screening is what is your risk. So that comes down to your age, your sex, and your family medical history. So if you have a history of breast cancer, ovarian cancer, and some other cancers, you may be at higher risk of developing cancer. So this is where your medical doctor comes into play. Make sure they know your history and ask your family. Sometimes we don't know, so ask them, what happened to grandpa? What happened to grandfather or grandmother? And find out whether there's any cancer history. And that helps us, as doctors, understand an individual person's risk. So for example, there are some diseases, let's say Crohn's disease, or colitis, that increases the risk of colon cancer at much earlier age than normal person. So when you think about colon cancer, which affects men and women both, we typically recommend that getting screening started at age 50, with a colonoscopy. Or nowadays there's the capsule endoscopies and virtual colonoscopies, or the stool quiet cards and things like that. So that's a first step. You can discuss with your doctor and have that. And repeat that every 10 years based on what the findings are. It could be less than that depending on what they found at the colonoscopy. This affects both men and women. If you have family history, it starts earlier than age 50. When you think about breast cancer screening, mammography, it could start as early as 40 with a baseline mammogram, and then every 2 years up to age 50, and then every year after that. That starts at when a woman becomes sexually active, and it is every 5 years as long as there's sexual activity or at-risk behavior. When it comes to men, the prostate cancer screening typically starts at age 50 with a discussion of the risk and benefit of doing testing. The PSA test, the blood test, is easy to do, but we have learned over the years, many men will die with prostate cancer than from prostate cancer. In terms of other cancers, the one that comes to mind is lung cancer, which so we know, for example, that in smokers, high risk of lung cancer. So we do now have a screening test, a CAT scan, to be done with low dose CAT scan once a year, starting at age 50, in patients or persons who have smoked more than 30 pack years, meaning they've smoked 1 pack per day for 30 years, or 2 packs per day for 15 years. And they are either still smoking or smoked within the last 10 years. They are at higher risk. And when we do the screening, we can find cancer earlier.
And I believe that this low dose CT and the information about how to and who is eligible, the first stop to get all this information is their primary provider, even before they get referral to go to a hematologist and oncologist. Is that correct?
That's right. So I think the first place is the primary doctor. Now, many community health centers would also guide you there. So if you don't have a primary doctor, you can go to a local community health center or Department of Health. And because many times they have fairs where they do cancer screening. So make sure you take advantage of that. And the Screen NJ website that I will share with you has all the information. So please look at what's available in your area and stay up to date in your cancer screening.
I think you made a really great point about going to the community center as well as health screening fairs, because community at large, they are really afraid of even speaking about it or discussing it with the primary, and they really don't want to go down that road. So these are the screening which are provided where they can simply have step 1. What is our next step once the screening is done?
So once the screening is done, I know we certainly hope there's no problems, and we should be just the most likely scenario that we find no problems, and then we recommend routine follow-up So if it's mammogram, every 1 or 2 years. If it's colonoscopy, every 3, 5, 10 years, depending on the finding. If it's lung cancer screening, then a CAT scan the next year. So there is a follow-up that goes with that. We encourage you to keep up with that. So that's the important part of those cancers. And I usually, you mentioned the cancer screening for skin cancer. I think that's important to have. We are darker skin people, but we still have risk of having skin cancer. So again, avoiding sun, putting sunscreen when you go out in the sun is really important. Even though we grew up in South Asia and we have the temperatures that are much higher than here, I think it's important to make sure we take precautions. I remember growing up in India, we would never be out in the when it was really hot. Those are the times you were indoors, and now we go to beaches when it's really hot outside. So the risks are different. So we just need to be aware of our activities that put us at higher risk.
I think this is an important fact, that awareness about how to protect ourselves from what are the environmental factors. It's really important for us as well. So moving on to further step, like say someone is diagnosed with a condition, the results are positive, and there is a sense of feeling like that's the end. Now
Yeah.
I have this. But parameters have changed. We have a lot more advances as far as the treatment options are concerned. And it's really important for everyone to know that being diagnosed with a positive finding is not end of the road. And I would like you to throw some light on that aspect, because it's a topic full of anxiety.
Yeah.
And it's very emotional for many. And then some degree of reassurance coming from a provider, an expert, can help a lot of people.
So that's a great point. So let me point that out for you. The reason we do screening, and I sort of mentioned it, but I didn't actually pay as much attention. So thank you for pointing it out. So the reason we do screening is to prevent the lethality of the disease. We want to prevent diseases from spreading outside where they started. So we'll find it early. So for example, a woman has a routine mammogram and they find a small lump. Well, that's actually a good thing that we found it, because then it can easily be cured. And repeat, the word is cured with surgery or an additional therapy. And that's a key, because then you may not have to see a medical oncologist like me to do any additional treatments. And that's a wonderful thing. The reason we do the lung cancer screening is to find cancer when it's in stage 1, early stage. So they can be removed by a surgeon and don't need any additional treatments. And that's what we found in the largest screening study. What we found was that we saved patients' lives. There were more patients alive because of the screening than otherwise. The very similar thing happens with prostate cancer, colon cancer. Finding cancer early is a good thing. Hopefully, after 5 years, you don't have to worry about it and can live on your life, a normal life. And so that's the idea. If you can't prevent it, find it early, take care of it, and cure it.
Who do not have insurance, they are reluctant to go for screenings. And I believe that there is something that CINJ and Department of Health have for this kind of patients. So if you can speak to that.
So I think that's a very good point, and that's why I asked for the ScreenNJ website, but then also the county health and local hospitals, health departments. We always try to do this health fair or have access either through community health centers, and many large communities where there's less insured people have that. So reach out to those community health centers for primary care and cancer screening, the county health departments, ScreenNJ, and local hospitals. I think those are great resources to have this conversation. One of the things that I think about that 50-year-old mom or dad who are working 2 jobs, trying to provide for the family, thinking about saving up for the college or paying for the college, and they're working hard to care for them. That's their primary motivation. And I get that. My parents are like that. But we need to make sure that you are okay, parents, so that kids are going to be okay. So we still need to make sure that even if you don't have health insurance, these resources will allow you to participate in your health needs, and they will help you insurance through state or get care that you need, the screen that you need, even if you don't have insurance.
I think that's a great piece of information, which actually will encourage a lot of people to get out of that uncomfortable zone and get into the comfort zone of getting some screening.
Yeah.
Okay, Dr. Saraiya. So going further, I want to ask you about when someone is diagnosed and there are options. There are two options: either the cancer can be treated chemically, or there are different surgical options. And now, how should one look at it as a person who has this diagnosis? So if you can just explain a little bit on that.
So I think what I'm going to try to do is what I do with every single person when I see them. I see there are 4 questions I have to answer as a doctor, as a medical oncologist. Number 1, what's the cancer? The aspirated biopsy is the answer. So, the pathologist tells me what the cancer is. Second question, where is the cancer? So depending on the cancer you have, the doctor might already have done some testing, like imaging, mammogram, ultrasound, a CAT scan, or they may order. It may be ordered by the primary doctor or the specialist that you go see. And many times the specialist you go see first may be a surgeon, a lung surgeon, a colorectal surgeon, a breast surgeon. They might be the first person that you see. And they may order some of this testing. So that's this question to answer. Number 2, where is the cancer? Number 3, what's the goal? And we hope the goal of the treatment is cure. And number 4 is, well, how do you achieve the goal? What do we have to do? And that's the question you asked. And the answer is broken down in 2 ways that I think of cancer treatment. One objective is to think about treatments that are what I call local treatment. So if you have a lump in the breast or a tumor in the lung, a surgeon can go in and remove that entirely. And when they do that, it's removed and potentially the cancer is cured. So that's a local therapy. For many cancers, some lung cancers, some of the cancers, radiation, like prostate cancer, radiation can also cure. It's also local therapy. Radiation treatment is essentially a high dose X-ray beams given directly to an area of concern. And that area may be a centimeter big or a few centimeters big. But they are using machine pinpoint the area of concern and try to kill those cancer cells. So those 2 are what I would call local treatments. For some cancers, cure requires treatment there beyond local because there is a risk the cancer cells might have already escaped the area. So even if you did local therapy, the cancer is not completely cured. If only one cell remains in the body, it could cause a problem in the future. So at that point in time, we talk about doing what I call systemic therapy, or things that go throughout the body. Either you take by mouth, you take intravenously, or injection. Things that go throughout the body in your bloodstream is what is called systemic therapy.
Yeah, especially when you use the 4 question, it really simplified the whole explanation. So going further down after the treatment and how the patient should look at it or the community should look at it, I also would like you to say a few words about any taboo associated with the diagnosis and how the patient should feel about it. Because sometimes every disease is not looked at it the same way.
Yeah.
A common cold, they'll say, it's a common cold. And if there is a diagnosis of cancer, it will be like, oh my God, you have cancer. So I think we really need to work on that health belief model, how we look at every condition, and how we need to make our patients feel better in their head, because they are already going through a lot, going through the diagnosis and treatment options and recovery. So what would be your message to everyone?
So I think the message is in my mind, it's quite simple. I think that, and I'm reminded, I was smiling when you're talking because I'm reminded of a case, a situation where, I go into a room and I'm talking to patient by themselves, and the family's outside. And before I go into the room, family says, "Hey doc, please don't tell my mom or my dad there's something wrong. And don't use the C word." And I go in there and I talk to the patient, and they know it. People know it. People know it in your face as a family member. They know it in your worried look. They know, when you're sort of, talking outside quietly, and when everything quiets down when they walk in, they know something is happening. And they know something is wrong inside. So one of the things that I tell both the family and the patient is to talk about it. And I mentioned earlier that know your family history. This has been a taboo topic for many generations potentially. So you may not know that grandma had cancer because she may not have gotten diagnosed, or we didn't talk about it. So at least we can figure out if we didn't talk about it. So have the conversation. What's my family history? I think it's important to have those conversations within our family to make sure that we know what our risks are. And when there is a diagnosis, look, I can't tell you that is not hard. It's very difficult. Forget the diagnosis. If you get a call from the doctor's office that, hey, we found a problem, a nodule, a abnormality in a mammogram, it may not be cancer, but that moment you hear it, you're thinking about it. From that moment onwards, it's in your mind, and it plays a big negative role in how we think about it. And some people will talk about it, many won't. I think we need to get to a point in our community, in our families, that we can actually express ourselves and talk about what we are worried about, what we are afraid of. And I think, hopefully, conversation like what I'm having with you today will help that, because I think we really need that. We really need to make sure that we don't hush what difficult time people have. When what I see is someone has cancer, they cannot talk about it. They cannot express their sadness, their worry, their fear. That eats at them alive. And that's really hard. So I really do want to make sure that we encourage everyone to talk about it. So I think we need to have the conversation beyond how are you doing, and really sort of be practical. What are your needs? Tell me, figure out how can I help you? People don't need, they may need some, feeling sorry. They don't need to be feeling sorry. They want to make sure that you can empower them and you can help them. So ask those questions. So that's sort of my advice, both at a friend and family level, but also caregiver level.
Oh, thank you so much, Dr. Saraiya. I think the whole idea of doing this kind of show and bringing Sati series in this forum of Healthline is not just to provide information or make it more informative, but also to change the mindset of our viewers. How do we approach and how do we provide support? Because emotional support, psychological support is equally important. And you said it beautifully. Rather than showing superficial sympathy or just sending the same kind of monotonous message, go as an honest and frank person and ask the patient, what do you want from me? That's exactly what a patient wants to hear, because everyone can make out who is really invested into their health and who is really going to help them. But these patients do need the support, not just the treatment. They also need the emotional support, moral support, and this can change the whole their paths towards their treatment pathway and how they are going to recover. So I think you said it really beautifully, and it sends a really strong message to everyone. And it is going to go in a very positive way, long way.
Yes.
So thank you. And I know that this was a very strong message, but I really need your final summation message to our viewers who watch this episode. And I'm so sure that with me, they also learned a lot. This is very informative. And I'm sure that there is so much more that we need to share with our community. So Dr. Saraiya, what would you say as your parting message for this episode only?
So the biggest thing I'll tell you in summary is all of us kind of have, first and foremost, a good idea of our habits. And we know what habits are good, what are not. So think about how to have better habits. Do less of the things that we know are harmful to us and more of the things that we know are good for us. That's where it starts for us and our family. Secondly, make sure you have a routine health evaluation with either a primary care doctor or a health clinic, and make sure you have doing your best to look for problems before they become significant problems. So we can take care, we can cure cancers at early stage.
Thank you, Dr. Saraiya. It is a beautiful message. Our viewers are really going to have a thoughtful process after watching this episode. And hopefully, after listening to this, they will pick up that book and make an appointment with their primary to follow the guidelines for screening. That, oh my God, now it is my time to go and get it checked out without fear, without having any reservation. So thank you for sharing all your expertise with us on Healthline, TV Asia Telugu channel. And looking forward to have another session with you in future. And I appreciate your time and your valuable expertise and your knowledge that you shared with us. Thank you.
Thank you so much, Varsha and TV Asia Telugu channel for allowing me to be part of this conversation.
ఎక్స్చేంజ్ 8,000 రూపాయల బ్యాలెన్స్ మ్యామ్.
ఇవ్వనక్కర్లేదమ్మా, 8,000 మీకే వస్తాయి.
ఎస్ మ్యామ్, మేము కేవలం హాల్మార్క్ 916 గోల్డ్నే అమ్ముతాం. ఇంకా మీకు దొరికింది 100% ఎక్స్చేంజ్ వాల్యూ.
క్వాలిటీ, ఇది మలబార్ ప్రామిస్.
ఇది మా హీరో అల్లుడు కోసం ఫిట్ గా ఉంటుంది.
పర్ఫెక్ట్ గా ఫిట్ అవుతుంది. ఇది మైండ్ డైమండ్, 100% క్వాలిటీ.
సార్, ప్రతి మైండ్ డైమండ్ న్యాచురల్. ఇంకా మేము 28 క్వాలిటీ టెస్ట్లు చేస్తాం.
28 టెస్ట్లా?
ప్రతి డైమండ్ జ్యువెలరీతో పాటు ఇంటర్నేషనల్ ల్యాబ్ సర్టిఫికేట్ కూడా.
కళ్ళు మూసుకుని మీ హీరో కోసం వజ్రాలను తీసుకోండి. ఇది మలబార్ ప్రామిస్.
హాయ్ గైస్, నేను మీ హేమచంద్ర. సో ఈ ఆదివారం ఒక క్రేజీ సాంగ్ తోటి మీ ముందుకు రాబోతున్నాను. ఒక బొక్కపడ్డ లవ్ స్టోరీ ఒక క్యూట్ సాంగ్ లా తయారు చేసి మీ ముందుకు తీసుకురాబోతున్నాను. సో ఈ సండే నా యూట్యూబ్ ఛానల్ హేమచంద్ర అఫీషియల్ లోను రిలీజ్ అవబోతుంది. అండ్ అలాగే టీవీ ఏషియా తెలుగులో మీరు ఈ సాంగ్ ని వినబోతున్నారు. సో ఇండియన్ స్టాండర్డ్ టైమ్ లో 10 AM కి ఈ సండే మేక్ ఇట్ ఎ ఫన్ డే విత్ దిస్ లవ్లీ బొక్కెటెనింగ్ సాంగ్.